Welcome to Africa Express. Today we are in Maryland. We will be talking with Dr. Daniel Karanja, who is going to be talking about poverty and reduction of hunger in Africa. Dr. Daniel is the Chief of Staff and Senior Fellow at the Partnership to Cut Hunger and Poverty in Africa. Dr. Daniel, you are welcome to Africa Express.
Thank you very much for having me.
Dr. Daniel, the world is seeing an increase in poverty and hunger. What do you think attributes to this increase?
Well, in the case of Africa, it is true that for a very long time, we have seen a big increase in the rate and incidences of hunger and severity of hunger and malnutrition. And there are many reasons that are attributed to this. One is that in the past we've had in many countries the population growth being higher than food production growth. And so for a long time there's been deficit or inadequacy of food, enough to feed the people so that they are healthy. But also because of that, we realize that the climate in Africa has become more variable. And I'm talking generally about Africa. We know there is very diverse climates. But in general, climate variability has increased. The amount of rainfall has decreased. And so it has become much less certain to have a good crop. And although we are working on different technologies that will deal with this challenge, it is not very easy to get crops that are drought tolerant and drought resistant unless we are putting a lot of investments. But in general, whether you're looking at the urban areas, there are greater incidences of hunger and poverty, and the same case in rural areas, although those are net producers of food.
So, the climate change, would you consider that as a major contribution to this, really?
Yeah, I think it is a big challenge that the world is trying to understand and also to try and figure out how best to deal with it. I think we have seen reports from the United Nations, from different task forces, indicating that over a long period of time, the Earth has been heating up. And because of that, we are losing the glacial peaks in the North Pole, and a lot of the water, coming down, but also rains in certain places. We have more intensity in rains, and we've seen a lot of flooding, but also in areas where we get insufficient amounts of rainfall, we are seeing that becoming less and less over time. So climate change is a big challenge that we're going to face. And unfortunately, in places like Africa and in places where we have deeper poverty, there are predictions that those countries will have to deal with that challenge even more. They will be the hardest hit by the effects of climate change.
So, is there anything that the African government, along with the AOU, is there anything that they are doing to address hunger issue at the same time? the climate issue? Because again, it seems like both are intertwined. And so if you're addressing one, you have to be addressing the other. Is there anything the African governments are doing?
Well, to answer that question well, I think I'm going to try and differentiate the different factors, look at the different factors that are really affecting the inability of Africa to produce sufficient food for its people. Besides the effect of climate change and the challenge of getting enough rainfall, and in Africa, you know very well that about 95% of agricultural production depends on rain. And this is very much unlike places like in Asia, where a greater share of the crop or the production is dependent on irrigation, which is more certain. So in Africa, we haven't been able to tap into the wealth of water resources that we have and use that for agriculture. And there are many reasons for that. We can talk about that. But also when you look at the technology, many African countries, science and technology and research and extension is publicly funded. So the fact that most governments have had inadequate funding and resources to advance agricultural research is the reason why we don't have new streams of technology and higher yielding technologies. If I gave the example of corn in Eastern Africa or Southern Africa, in the earlier years, in the 60s and 70s, we had new hybrids of corn that were producing, well, 10 to 15, 20% more than the traditional varieties. But in much recent times, it has been very difficult to get new varieties, to get new technologies that would produce more. But if you look also at the patterns of agricultural production, you find that as the population has grown, there's been more pressure on land. So most of this land has been used again and again, and mostly with inadequate fertilizers, inadequate chemicals, and so basically you find that land productivity and the soil fertility has been declining over time. People have gone ahead and cut down the trees and expanded the agricultural production areas, even in areas we call fragile lands, where basically agriculture is not the best thing to do. And so they are again limiting productivity growth. And the pressure on land is increasing day by day. In Africa, people subdivide their land to very small units that are uneconomical to produce on. And so that again affects the level of technology that they can use and the scale of economies that they can get out of their land. So when it comes to the question of what the governments can do, one of the things that's critical is investing in science and technology, because we depend on that to improve productivity. Number two is developing policies that will incentivize agriculture so that smallholder farmers, who are the majority of farmers in Africa, can have an incentive to invest in their production and get higher yields. The other thing that they can be able to do is provide access to factors of production. Think about credit is a major constraint in Africa. We don't have sufficient credit. Farmers don't have enough credit. They cannot purchase inputs. If they cannot purchase inputs, then their productivity levels decline. And so availing credit is important. The fourth thing is that we find that in Africa we lose about 40 to 50% of the production because of post-harvest losses. And so we need better storage. We need farmers to be able to process, work with small businesses to process their produce so that it can stay longer, so that it can go farther, and it can fetch better prices. And these are challenges we see in Africa.
Do you think so many conflicts that are going on within the continent, and people migrating out of the conflict areas, becoming refugees, that perhaps it also contributes to hunger to wherever they go to.
Absolutely.
Is it a factor?
It is a big factor, and it is a big factor in many countries. If we can cite, for example, Democratic Republic of Congo, if there is no peace and stability, farmers cannot feel safe to invest in their economic activities, and they cannot farm. They cannot feel safe in the rural areas. They cannot go out in the farm. We know that most of the farmers in Africa are women, and women and children are the most hurt when it comes to wars and civil conflicts. And when they move away and migrate from their farmlands, normally they tend to leave their land like that. And so it's not farmed, and you find that then they suffer hunger and poverty because they're impoverished, because agriculture is their mainstay. And in Africa, where 75% of the people live in rural areas and depend largely on agriculture for their economic livelihood, then they are deeply affected. So we've seen that in places where peace and stability has returned, farmers are able to go out, they're able to eke a living out of their land. And so we need peace and stability, and that's another role that the government could play.
What about the migration of youths from the rural area to the cities? Leaving the aged who are no longer capable of actually doing farming, to stay, leaving them back. And isn't that part of it also? And if so, what can the government, or what can we do, all of us, do to attract the youths back to the rural area, instead of everybody wanting to be in the city, at the desk, working?
This is a big problem that you've actually touched on, and I'm deeply motivated. It's really a passion that I have to deal with this issue, and I will indicate why. Because in Africa, like we said, most of the people live in the rural areas. We're talking about 75% on average, and they depend on agriculture. Now, as I myself grew up in the rural area, as we saw our parents farming using very rudimentary technology, working so hard, spending entire days out in the field, farming with a hand hoe. Now, most youth look at that and they don't see that as their career. They were told that the best thing to do is to go to school, study hard, and get a job in an office. And over time, we've found that because of poor economic growth, there are no sufficient jobs created in the urban areas to absorb all the youth that are coming out from the schools. And so the youth finish their education, they feel they need to go to the cities to get a job, and in many, many cases, and in many big cities, that's no longer happening. So they end up in the slums, they end up getting involved in crime, and that is becoming a big urban problem. But back to the rural areas, because the kids finished school and they went out looking for a job, they leave their aged parents who used to depend some on their labor on weekends, and when schools are closed, they would assist their parents in farming, but now it's only the aged parents. Now, it's very interesting because I listen to politicians and they keep telling farmers, you need to increase your effort and do more to produce enough food. When you look at the farmers that are being told this, on average, I did a study in Kenya a few years ago, On average, we are talking about farmers that are beyond 50 years of age. In another decade, they'll be 62 years and above. And if we are depending on these aged farmers to produce sufficient food to feed an increasing population in Africa, then definitely we'll have a big problem. So the youth goes out, the farmers are left without sufficient labor or energy, and then we expect that to withstand the pressure in the future. So what I'm saying is, unless something is done to provide incentives to keep the youth in the rural areas by doing a couple of things. One, investing in technology so the youth don't have to use the hand hoes or to feel they have to use the hand hoe to farm. Number two, is also investing in the service sector in the rural areas. The youth are technology savvy and they can be able to provide some of the services that are needed in rural areas. For instance, they use cell phones a lot these days. Farmers can be able to access market information and prices on their cell phones, and the youth can be organized to provide that service. I think it is time that we reached out to our youth, organize them into cooperatives, and maybe train them in management of resources, of capital, so that they become entrepreneurs, they become businessmen and women in the rural areas. We need to invest in industries in the rural areas. If you look at patterns around Africa, all the industries are close to the urban centers, and so the farmers will take their raw produce to the city. That's where it's processed, and so the jobs remain in the cities. But because there are not many, kids follow the jobs in the cities and they can't get sufficient jobs. Right. So if we invested in the rural areas so that kids can actually work in industries, agro-related industries, like processing, like packaging, right, like transportation, we can retain our kids in the rural areas, and they will add efficiency in the production of crops and produce and livestock in the rural areas. That way we will increase productivity while creating jobs and improving livelihoods in rural areas.
The other factor also is health. There are certain areas in Africa where you can come into a village and mostly all the capable hands are affected by HIV. And there's no one who is healthy enough to engage in farming. What effect does that have in a community who are even if you're trying to bring back the youths, but they're not well? What effect does health in general, or what effect does it have?
There are many studies that have been done in Africa in the last 10 years or so that indicate that poor health is a great robber of labor, and especially farm labor. It's both industrial labor and farm labor. But now we have numbers that indicate that as people, as communities are affected by HIV/AIDS, productivity has declined in these communities. And the tendency is that this particular disease, HIV/AIDS, has tended to actually victimize or kill the top crop in the village. These are professionals, these are young people between the age of 19 and 40, and these are the vibrant people, laborers in the community, and that has really affected productivity. I remember seeing a documentary, this is about 15 years ago, in Uganda, where this particular community had been devastated by the disease, and all you could see were the elderly especially grandparents with a lot of young people. And just looking at their fields, you realize that actually they didn't have enough energy to take care of the young ones and also go out in the farm and farm well. And I remember doing some studies in some parts of Western Kenya. And, whenever we went out to do surveys, we would find that, although we had made appointments with farmers, we would find the whole village has moved to certain areas. And it's because there was a barrier or because they were going out to care for a friend. And so just the care that's needed for these particular patients, just the concern that people have for the community, it's taken away from agricultural production. And so especially when you think about the youth, if we are to sustain them and make them more productive, health services have to improve. And it's not just HIV/AIDS that's affecting agriculture.
And Dr. Karanja, you were saying that there are other illnesses. Could you explain to us some of those briefly? Let us know.
Yeah, although a lot of attention in the recent past has gone to HIV/AIDS, and indeed that's deserving because HIV/AIDS has been a major killer of populations in Africa, and the greatest level of incidence of HIV/AIDS has actually been in Africa. We are talking 70% of the incidences and 70% of the deaths being in Africa. There are other diseases that have kind of received less attention because of that.
Right.
And in recent times, we've seen some of them re-emerge as of major concerns. And one of them is malaria and tuberculosis, which we thought we had taken care of it and controlled it, but it has become back as a major problem. There are a lot of other reproductive health issues, maternal and child health concerns, a lot of waterborne related diseases, especially with poor water infrastructure and poor water services, and these have re-emerged as major concerns. Now, most African governments in the past invested in the urban areas, so you get better facilities, better infrastructure, in better health services, better water resources, or cleaner water in the urban centers. But in the rural areas, most of these services are extremely poor. And so again, the farmers whom we depend on to produce sufficient food of good nutrition for our countries, again, they are hit hard by lack of services, health services, and the lack of attention to them. So health continues to be a major issue.
Right.
We talked about most of these farmers being advanced in age.
Right.
And as they advance in age, they need better health care to have sufficient strength to work. We need, to attract the youth in the rural areas, they need to feel comfortable that we are taking care of them,
right,
especially as it relates to health. So in terms of investments, we need to consider investments in rural areas. But there is also another element, because agriculture and health, they are very, very related.
Right.
You've got to eat well in order to work better. And so agriculture needs to produce good nutritional and nutrients and nutritional foods that can provide the energy, the vitamins, and everything, and protein that requires to build a body so people can work well. And those are things that we have paid much less attention to.
Okay. Assuming all this are taken care of, the issue of once they are able to raise their crops and being able to sell it, it's quite all right. You can have a farm and you're not going to eat everything you want to, yes, buy all that stuff.
Yes.
Are there things put in place or system put in place to make sure that the crops that are raised are including not not just raising the crops, but also the packaging and everything meets the international standard or even the regional standard, so that they can be able to do inter-regional trade within Africa?
Let me address that question by going back a little. In many years ago, we are talking about maybe 70, 80 years ago, most farmers produced for subsistence. They basically produced food to feed their families. And when they needed to buy other goods, they would basically take their surplus to the market and they would barter. They would trade it.
Trade and barter.
Yes,
okay.
with other. And the same happened to, if they needed to pay for school fees, they would probably provide food, their crops as food to the school. And that was easy. But now with the economic advances that we've had, the whole idea of developing markets that provide incentives for farmers, not only to produce enough for themselves, but to be able to sell so that they can use the surplus money to take their kids to school, to take care of their health, to purchase products that they need around their home, is really critical. And in agriculture, especially smallholder farmers, there was an assumption that smallholder farmers are not responsive to market signals. But there are many studies, including some that I did when I worked with the Kenya Agricultural Research Institute, that showed that farmers were sensitive to price incentives. And farmers, once they know where they can sell their produce better, they will do everything possible to make it happen. So the idea of having good incentives and good policies that create markets that are more certain for these farmers, the better for them. In the past, most African governments used to control the marketing systems, and they would announce a price at the beginning of the season, and then farmers would know how much they will fetch at the end of the season. But because of the structural adjustment program of the World Bank introduced to most African countries in the 80s and 90s, markets were liberalized. And so it's the power of supply and demand that works. But the problem in Africa is we don't have good market information. So farmers would not be able to tell, what the price they will receive. And often because many farmers produce the same product together, at the end of the year when they harvest their produce, there's so much of that produce in the market so that the price goes down, and that acts as a disincentive. So most African countries have organized themselves into what they call regional economic communities. And basically they are trying to put in place certain incentives across regions, not just within countries, so that to allow some of these trade flows to happen. We've done our studies and we know that if African countries were to trade with each other, they would have a greater economic gain than even by selling their produce abroad, because it's expensive. They sell it raw. Sending it abroad is expensive.
Yes, you have to package it.
Exactly. So again, going back to what we talked earlier, it's investing in processing of those products so that then you get a higher value product that then you can sell outside. But let's talk about the standards, because that's something that's really critical. In order to sell produce within the region or even internationally, you have to meet certain standards.
Yes.
And one of the most critical is the food safety standards. And we often talk about sanitary and phytosanitary standards. In order to, if I gave you an example, to export products to the US, they have US sanitary and phytosanitary standards that you have to meet.
Yes.
If you don't meet those standards, then your products cannot come in. And unfortunately, back in Africa, there is insufficient information to the farmer once they're growing their produce to even know what standards they are aiming for and what's the market standard. So being able to work with the farmers, provide them with sufficient information, including consumer preferences, in the markets that they are targeting, so that as they grow their produce, they have a standard that they are aiming towards. Then that way they'll capture a better market value for their produce.
Dr. Karanja, it sounds like it's a very vast subject, and I think that what we'll do is that we'll have to sit down again and really get into this aspect of it, because I think that the audience, especially our African audience, needs to understand this. You know, that that is a multifaceted issue, and that so taking time to actually address it so that they can understand it will be very helpful. I know that you do other projects, and I do want to get into that. That's why I kind of like changing for us to come back and really get into this in depth. What other things do you do? What other hats do you wear?
I should have started by saying that one, as the Chief of Staff and Senior Fellow at the Partnership to Cut Hunger and Poverty in Africa, this is a non-profit organization that was started 10 years ago by 4 African presidents. The current president of Uganda, President Museveni, the former president of Mali, President Alpha Konaré, the former president of Ghana, President John Kufuor, and the former president of Mozambique, President Joaquim Chissano, together with several former congressmen and U.S. university leaders and leaders of U.S. NGOs that were very concerned 10 years ago that Africa was not getting the attention it deserved, especially on the issues of agriculture, rural development, hunger and poverty alleviation. And we've been working on public policies, particularly looking at how U.S. policies and programs can effectively support agriculture and rural development in Africa. So that has been my primary work these past 10 years. We work very closely with African ambassadors. We work with the African Union and NEPAD. We work with many regional economic communities on 4 different elements. One is improving market access and trade for African agricultural products, improving investments in infrastructure, which is very important for Africa, doing work on relief to development issues. When you think about the many emergencies we get in Africa, there's a lot of countries that donate food aid to Africa, but making sure that that food aid supply also works with local markets and it doesn't disrupt local market conditions. And lastly, we work on the issue of capacity building for science and technology, which also includes higher education. And on all these issues, I've been deeply interested. Working in the U.S. as an African, I've been passionate about working with other Africans in the diaspora and trying to figure out how best we can be able to give value back to our continent. You know, people talk about brain drain, and a lot of the professionals in Africa, whether it's doctors or nurses or in agriculture, they've gone and worked outside the continent, yes, which is sad, but there are reasons why they leave. But I think that has been turned around, because if you look at areas, countries like China, countries like India, it is really the diaspora, because they are passionately interested in making a difference in their countries. They went back and not only invested their capital, which they've accumulated, but they also reinvested their skills and their knowledge and brought their networks to bear on institutions in the continent. So that's what we are desired to do. And we have started an association. It's called Association of African Agricultural Professionals in the Diaspora. We are based in Boston, and we have We are working with many professionals here in United States and also in Canada, and we are reaching out to professionals in Europe, ultimately around the world, so that we can figure out the best way to start investing in our institutions and working with our universities, working with our agricultural research systems to bring back some of the skills and the knowledge and the resources that we have gathered over time. And I think that will be a good incentive that will improve productivity back in Africa. And the core interest there is to see Africa grow again. And already if you look at the numbers, Africa is doing much, much better the last 10 years. Agricultural GDP has increased. We've seen an average of 5% in many countries, even with the global food crisis and the global economic crisis that hit in 2008. And even now the prices are going back up again. But we see a lot of good responses in economic growth in Africa. So I work with Africans in the diaspora to try and provide some value back in Africa.
Dr. Karanja, I think you definitely have to come back because there's so much knowledge that I need to bring out that we really don't have too much time today. But I think that we should definitely do a part 2 of this because, again, this is an information that is very important, you know. But go ahead.
Before we finish, I just have to say this, because the other thing that Africans in the diaspora can do, many people are passionate about their countries, they are passionate about their communities, and they like to give back either to their families, to their communities. We've seen a lot of them, you know, develop health centers, provide equipment to local health centers or local schools. Some are building schools in their communities, some are helping churches, and they're finding, you know, ways to give back to the community. One of the things that I'm passionate about is reaching out to the diaspora and actually encouraging them to do more of that. And my wife and I were fortunate 10 years ago to start a high school in our community. It's a Christian high school. It's called Goshen High School. And we started with 13 kids. And we wanted to give back what God has given us.
Yes.
Because we benefited from education, and we thought that's the best thing we can give back. That school today has 600 kids, and we work with them to build their skills so that they are also providing services to the community. We also use the facility as a community resource where farmers gather together, and we train farmers on new uses of technology. And we bring community leaders together, and they can talk about community services and needs. And so we see that the diaspora can invest a little money and some skills back in their community, and that really helps the community to grow. And if we all did a little bit of that wherever we come from, Africa will slowly rise again.
That is absolutely right. A whole bunch of drops of water, is that how they say it, can become a full bucket.
Absolutely. Absolutely.
Dr. Karanja, I've really enjoyed talking to you. And like I said, I definitely want you to come back again for part 2 of this to talk about market access and financial access to finances in cutting poverty, specifically within the agricultural sector. So again, thank you so much for being on Africa Express. You have been watching Africa Express with Dr. Daniel Karanja, who is the Chief of Staff and Senior Fellow at the Partnership to Cut Hunger and Poverty in Africa. Again, thank you for watching Africa Express and continue to watch us.
Thank you very much. Thank you for having me.